welcome to Open Studio. Today's show is dedicated to celebrating World Hand Hygiene Day, which takes place every 5th of May annually. And with us we have our guest, Dr. Abrahams and Nurse Kronia. Welcome to Open Studio.
Thank you very much, Caroline.
So actually, good hand hygiene has been neglected in our communities because of lack of information. So today's show will be giving that information and talking about the importance of hand hygiene. Welcome again. So Dr. Abrahams, can you please introduce yourself? Tell us in few your study background and what do you do and your involvement on this.
Okay, I'm Lisa Abrams. I'm actually a medical doctor by profession, but I specialized in medical microbiology. So I'm working as a clinical microbiologist currently at Tygerberg Hospital, and I also work for the university in their postgraduate courses. So I'm based at the Unit of Infection Prevention Control at Tygerberg Hospital.
And your involvements with the
we're basically involved in infection control in general in the hospital, and we make sure that the policies, infection control policies are actually seen to. We're also involved in setting up of policies, especially with TB and all infectious diseases. And then we're also involved with surveillance work, doing surveillance on hospital-acquired infections. And then we work closely with the management of the hospital to make sure that safe practices are adhered to in the hospital.
Okay, thank you very much. And Nurse Kronia, can you also tell us about yourself and what you do?
Yeah, thank you. I am a nursing sister, that is my background, but I've been working in infection control for the last 18 years, mostly private, and then I studied further at the University of Stellenbosch in infection control. And then I started working at the University of Stellenbosch as a lecturer in infection control. And we basically train nursing staff and also even our non-healthcare workers working in a health environment in infection control. And we've got different degrees and courses that we run there. Great. Yeah, so this is basically what I'm doing at the moment.
Oh, great. Okay. So can you please tell me or tell us about the World Hand Hygiene? What is it about? What is it? We can start with one of you.
So the World Hand Hygiene, this is an initiative that's been running for quite a few years. It's a World Health Organization initiative. And every year on the 5th of May, various countries, they have a hand hygiene event. And this is to promote hand hygiene awareness. And for example, I became involved last year when we organized a hand hygiene rally. Okay. So as I said, this is actually the significance of the date is actually after the 5th of May was about almost 150 years ago when Semmelweis, which was known as the father of hand hygiene, actually instituted hand hygiene practices in obstetric wards. So the little bit of history on that is that Semmelweis was an Austrian physician who worked in the obstetric wards, and he saw that there was a high increase in puerperal sepsis, in other words, mothers dying at birth, and that was due to infections. And what he actually noticed was that when the doctors, in those days, the doctors used to work in the do autopsies, work in the mortuary, and they would actually then come back and work on the obstetric patients doing examinations, etc. And what he basically then theorized that the doctors are bringing the infections after they do the autopsies, they actually bring it to the mothers, and that was known as childbirth death. And he then instituted the first hand basin. So before a physician came and actually examined the patient, they had to wash their hands. So Semmelweis is known as the father of hand hygiene, and that was around about May in the late 1850s there around. Okay. So that's why it's actually being celebrated and commemorated. And last year at Tygerberg, we actually had a relay at the entrances of the hospital, where we showed, we lined up, I think it was about 200 people, we had various events, etc. And each person, as they carried the baton, they would show a hand hygiene moment.
That's great. Okay.
So this year we're actually trying to do the same thing. But this year the focus with the World Health Organization is actually on decreasing or reducing surgical site infections.
Okay,
So this year we're actually having the same relay.
Okay, thank you. I'll have to continue. Sorry about it. Can you just tell us why should we wash our hands and how should we wash our hands and the importance of that?
Yes, so the washing of hands is very important because we know that most organisms, germs, viruses, bacteria, etc., are basically carried around by the hands. It cannot jump from one area to the other. It is basically carried with the hands from one area or one person to the other. So this is the main vehicle, and washing of hands actually washes away up to 80 to sometimes 90% of the bacteria sitting on the hands. So it is really the best method to get rid of bacteria that can actually make people ill and spreading it from one person to the other.
Wow, I can imagine. Thank you for both what you said,
And
because
just to reiterate
yes,
what you says, that the germs, you cannot see the germs. So
True.
people don't, if they don't see anything, you know, they think that if I touch a patient, I can't be transferring these germs. So because it's invisible, you know, people are very lax in terms of.
because it was that they used to have child death.
Yes.
So now they see that it does work.
Yeah.
And also, how should one wash their hands regularly, obviously?
Yes, so there's a few instances in which you can remind yourself to wash your hands. And one of the most important things, firstly, is if you visited the toilet, you must actually your children, you must make them use the hand wash facility immediately after they've used the toilet facilities, because that is a very important way, because the bacteria that's sitting in your gut can end up in your mouth and in your intestines and can make you ill or spreading around like that. Working with food, before you prepare food, after you've prepared food, and then in an hospital setting we have a very nice 5 moments of hand hygiene that we advocate for nursing, and we usually tell them before you touch the patient, after you touch the patient, before you do an aseptic procedure like doing a wound or catheterizing or whatever. The other one is if you accidentally touched body fluids, then you need to wash your hands. And the last one, when you touch the surrounding of the patient.
You still need to wash your hands.
Yeah.
Thank you. Yeah. Okay, now we need to go to a short break and we'll be back with more Open Studio. Thank you. Welcome back. If you've just joined us, we are celebrating World Hand Hygiene Day with Dr. Abrahams and Nurse Kunya. Welcome.
Thank you very much.
So, have you ever wondered how clean your hands are after you've washed them? Well, I'm still wondering. We have Nurse Kunya. She's going to demonstrate to us exactly how clean they look. Can you show us the demonstration? And please just give us guidance while you're doing it.
Sure. We use a device in the hospital which works excellent to show people what germs actually remains on their hands after they have touched surfaces with germs. So we've got a potion here called the glitter bug potion.
Okay.
It's got reflecting ability if you look under a UV light.
Let's try that out.
So we'll try that.
Should I?
Yeah, so you
Rub
just
it?
rub the potion in.
Okay. Oh, okay.
Yeah, very well. And then what we usually ask the students or the nursing staff is to go and wash their hands. And then we've got this UV light called the glitter bug, under which the person will put his hands, and then it will show all the areas that you've missed, which actually are a representation of the organisms that remained on your hands. And sometimes you think you have washed your hands very well, but you actually didn't. There's still some organisms
Can we
remaining.
try that and see?
Yeah, we can.
Okay.
So we
I
usually
just hope my hands are not that dirty.
we usually darken a room very well.
Well, I'll have to show you how you wash your hands.
Okay.
So,
So you can do that.
Okay.
so yeah, so you
So
don't necessarily.
this is more like washing my hands
so,
now.
Yeah,
Okay.
you don't need water, and this
So
is
you
what
basically
is.
do palm to palm,
Okay.
dorsum to dorsum,
Okay.
other side, and
Okay.
you do the interdigital spaces.
So the idea is that you have a friction or rubbing action
Nails.
of all the areas of the hands, because
Okay.
the
Oh, and that
friction
one.
Yeah.
is actually loosening the microorganisms and helping to get rid of them.
That's interesting. And do you always have to use both of them start
Yeah.
with the...
Yeah,
Okay.
so you don't even need water. So this is a very good replacement, is alcohol hand rub,
Wow.
which you can buy at any shop these
What is
days.
the name of it?
So this is just a
Just
one that we
70%
use.
alcohol.
Yeah.
Oh, 70
So basically,
okay.
there's two ways you can use. In most of our hospitals, we use soap and water.
Yes.
But because you know, in every ward there needs to be a basin, but in some places the basin is quite far away.
Yes.
So, and studies have shown that if you put a basin more than 1 meter away from where they're
They
supposed
get
to use it,
lazy
people don't do it.
because they
Also,
get- yeah.
in winter it's cold, so people don't want to go and wash their hands under the cold water, etc.
Yes.
And there's a big gap, you know, mind the gap. If you go to the UK, you hear about mind the gap. There's a big gap between knowing what to do and actually doing the right thing.
So this kind of helps.
This helps. The only
It's quick.
yeah, it's quick. And
Yeah.
and for in terms of you washing your hands, the duration they say it should be about between 30 and 40 seconds, or to 42 seconds to 1 minute. And it's they say if you want to know that and you don't have a wash, you have to sing happy birthday twice, and you know you've actually washed
Wow,
your hands
that's interesting.
adequately. So basically, the only time where alcohol is not actually indicated is when your hands, say for example, a healthcare worker touches a patient and they have pus or blood, so it's physically soiled, your hands are dirty, physically soiled,
Then you can't.
so then alcohol won't be effective. And then in certain cases where they have a certain spore-forming bug, which
Then you
normally
can't use
then
it.
you
Okay, great.
cannot use
So
it,
then
yeah.
what is the next step after
Okay.
you've used this?
So this, just remember this you don't use routinely. This is just to show up the bug. So this would be like dirt. It's a UV thing. So we
Okay.
use this as a demonstration.
Yes.
And what we do is we do hand hygiene audits
Yes.
within the hospital. So we will go and we will show the nurses, you know, demonstrate to them how you wash, etc. And then we'll show them which parts they missed. So if they don't wash up properly, they put their hands under the UV light. This UV light will actually be switched on, and then we won't see it now because it needs to be dark, you know, and it's UV light. So you'll see the parts which they normally miss are the interdigital spaces, in other words, the web spaces, the nails, and perhaps maybe you can comment on what else.
Yeah, and usually the tips of the fingers as well. And we think maybe we mustn't give so much attention to that, but the
So
thing
that also makes
is very
things.
important.
So now it's just a general question, like when someone is washing their hands, because we know that is a norm, how long do you have to wash it? Like you just wash quick
yeah.
and...
So what is important is if you stand in front of a wash basin, you must wash your hands. Firstly, they say you must rub vigorously to
Yeah.
get rid of it, the first
Friction.
thing.
Wow.
The second thing is if you can have a song in your head, thinking about singing a happy birthday to you.
I'm going to try that one.
Yeah, if you've sung that song in your head
Yes.
twice,
Twice.
that is the time frame that you basically must spend rubbing the rubbing
Wow.
action of the
Okay,
hands.
great.
And
And
then-
so then what happens, can you
if
just
you
show us?
put your hands in
Okay.
here now, you would be able to see. I hope we can see it.
Is the UV in?
Yeah. So usually you
wow,
will
I
see.
see a
Yeah.
bit.
You see the white
Yeah.
spots.
Mm.
So what happens is you will be able to see that thing, and the nurse would. And we will tell the nurse, okay, now go back to the wash basin, go and
Yeah.
wash
Yes.
again. You haven't
Jeez.
washed enough.
So you need to wash more.
Yeah.
And
This
it's
is
to show
great.
the nursing staff that actually you really need to
And, then,
wash.
Wow.
and another important thing is also if you have to take off your ring because your
Yeah.
ring you won't get to the skin.
And there would be things?
Yes,
overlap
there will be
there?
bugs, yeah.
And this is why we advocate very, very strictly bare below the elbows in
Yes.
hospital. No ornate rings, no
Yes.
watches, because of the bacteria that go and sits there, and you transfer it from one patient to the other. So we have this
Bare below the elbows.
bare below the elbows. You nurse a
Great.
patient bare below the elbows.
So the products, are they in all the hospitals, or
Yeah,
or maybe they just
we've
use
got,
normal water
look,
and
look in the,
they can
in-
use everything?
Yeah.
That's what I'm trying to ask.
If I can also tell you that we've got a famous Professor Mehta, she actually in some African hospitals has created or made their own alcohol hand rub by taking pure 90%
And diluting it.
alcohol, which you buy at pharmacies, and then you add some glycerine to that in a spray bottle. In areas where there wasn't money or
the resources were.
so it can easily be made.
Oh, great.
Yeah.
Sure. This is so interesting. Okay, I
Yeah.
used to think my hands are so clean. But it makes sense because I watched them once. I didn't sing my happy birthday song.
Yeah.
Anyway, thank you again. If you've seen for yourself that actually good hygiene is very important, especially with washing your hands. We'll be back with more in OP Studio. Welcome back. As we still are discussing or celebrating World Hand Hygiene Day, and with us in the studio we have Dr. Abrahams and Nurse Krunier, if you've just joined us. Welcome back again.
Thank you very much.
I really enjoyed the demonstration, and we can keep it to ourselves that what we saw in there for now. Anyway, what are the consequences of poor hygiene compliance?
Well, it has direct consequences on your infection. So people who go to hospital they can pick up infections, and we call them hospital-acquired infections. So, I mean, if you look at the data for hospital-acquired infections, the good data you get is normally from Europe and from the States. And in the States, it's about 1 in 10 patients who come to hospital will pick up an infection. Studies have shown that in the developing world, in third world countries, that increases. So 1 in 4 patients will pick up a hospital-acquired infection. And then in the ICU, that actually increases to almost to 40 to 50%. So hospital-acquired infections, there are certain consequences, because that means you have to go on an antibiotic, which has side effects. It could lead to antibiotic resistance if you're on the wrong antibiotic. It means that the patient, if this was a private setting, the patient has to pay for an extra stay, so hospital costs are increasing. And then also you have certain bugs that are resistant to almost all antibiotics.
Can you imagine if you just washed your hands? All that could have been avoided.
Yeah.
So
Exactly,
it shows
yes.
viewers it's very important to wash your hands. It's simple, but it's important. Okay, just tell us the role that hand hygiene play in preventing illnesses.
Yes, so
Just to add up,
if we
yeah.
think in the community-wise, even in creches, in schools, we can actually prevent a whole outbreak of very serious diseases. And I'm just thinking now, Dr.
Typhoid
Riza,
fever.
typhoid fever, or even the big one that we had in Sierra Leone, the Ebola virus.
yes, I
that was
remember.
also spread through contact. Through a hand, and it shows you how quickly something can spread via the hands. So in the community, one can really stop infections. So even now in the winter times, with the colds and the flus, we can really lower
But how do you guys encourage people? Like, how do you encourage them? Because everybody gets like, it's just washing hands.
Yeah, look, the thing, it's all about education. And as I said from the start, if you can't see what the bugs, if the bugs were like spiders or tarantulas, you know, people would actually respond. And it's that gap between knowing what to do and actually doing the right thing. And just to add on in terms of diseases, you know, especially with diarrheal diseases, sometimes you have diarrhea season and there's lots of diarrhea, babies have diarrhea. So when the mother actually changes the baby's nappy, she should wash her hands before then. And then after nappy disposal as well, because if they have other younger siblings or older siblings, they can actually spread the disease amongst families. So it's quite important, and hand hygiene is something simple. And studies have shown that with hand hygiene, you can actually prevent about 60 to up to 70% of infections.
Okay, great. Just in short, how can people make it a way of life, like hand hygiene?
Yeah, as I've said, you don't always need water. And if we think about these little bottles that we nowadays can buy at any supermarket or you can buy it really any place. If you have something like this in your pocket or in your handbag, you can always just spray your hands. Or seeing that it's just important that you must look that it's 70% alcohol at least to be effective. Yeah, and luckily for us in South Africa, we've got a lot of places where we have taps
Running
available.
water.
True.
So it's
Like,
not
it's
so
not that
bad
bad, yeah.
that there's
Yeah.
no water.
It's all about us
Yeah.
doing the right thing.
So
Great.
yeah.
What about sanitizer? Does it count?
Yes, I think definitely so. Sanitizer, even wipes, even if you have a wipe, as I've said, even if you wash with water and you
Yes.
wash 70 to 80% of the germs you wash off
Yeah.
anyway.
And remember, I
Great.
said there are certain instances where you won't, if your hands are visibly soiled with blood or pus from a
Then you
patient,
can't.
etc.
Yeah. Okay, great.
And also, just lastly, when you do visit your relatives, before you enter the ward or the room, please wash your hands and afterwards,
To
because you can
wash
take
your
germs
hands, yeah.
home.
Okay, great. Thank you so much for joining us and doing the demonstration. It was quite informative. I learned a lot, and I will sing happy birthday twice. Thank you. And thank
you
you
very much.
so much for joining us on Open Studio. And we will be closing up with a play instead about what happened last day in World Hand Hygiene. And for those who want to be part of Open Studio, just email us on openstudio@capetowntv.org or call us on 021 448 0448. And make sure you tune in every weekdays at 5 o'clock for more Open Studio. From me, Caroline, goodbye, thank you, and God bless.